So thank you very much. I'll turn it back over to Zachariah for introductions. And I look forward to participating today and meeting you all.
Thank you very, very much, Robin. As I've said earlier, Robin serves as a mentor of mine. We met last year during the last 2 years, actually, during How Time Flies, during the AMR ambassadorship program. And since then, I have learned a lot from her. So I'll be sharing with her and you all on this call briefly what we do at UDS. And she will be building on that and sharing with us some answers to the questions we have asked her on antimicrobial resistance and how communications could be used to solve the menace of antimicrobial resistance in the environment. So please, you can you can mute your mic if you are not speaking and you are in an environment that is not quiet. Okay, thank you very much for muting yourself. So I will be introducing to us what ODR is all about. So ODR stands for the Osman Affordable University Young Antimicrobial Resistance Steward. ODR is a youth-led organization, a youth-led group which focuses on antimicrobial resistance, seeing how we could communicate effectively to youth, understanding that youth share a large proportion of next slide, please. So we can have the next slide so we get to share with ourselves what we've done. And yeah, so here in the third slide, we have a brief picture showing next slide. Yeah, here in this third slide, we have a big picture showing the cross-section of individuals at UDS. We had a number of students spanning across 20 faculties in the Osman Affordable University. And we are currently building on having individuals from all over the country and Africa at large, from undergraduate students specifically. Currently, we have students from 25 faculties, integrating both medical and non-medical practitioners, which shows the multidisciplinary aspects of antimicrobial resistance and how we could collectively come together, learn from ourselves, and provide solutions as youths to fight this growing menace. So this is a cross-section of the number of individuals, members we have at ODS, which shows how if you notice here, most of the people here are youths, and shows why we put strength on the youth aspects in curbing antimicrobial resistance. Next slide, please. So at UDS, we have a vision, which is to create a multidisciplinary team of students that provide sustainable local solutions to curb the menace of antimicrobial resistance and related public affairs. This is spurred from us understanding the power that youth have in our community, and it's all supporting the Global Action Plan, which is on the first Global Action Plan on antimicrobial resistance, which is building on awareness advocacy, seeing how we could prevent the spread of antimicrobial resistance through continuous education. So as youths, we feel we have this energy, we have this passion, enthusiasm in us to see how we could collectively raise the awareness level of antimicrobial resistance in our community. Recently, I conducted a survey, a non-structured survey, a semi-structured survey actually, in my community, getting to assess how much individuals understand antimicrobial resistance, where I get to ask them simple questions like, when did you hear about antimicrobial resistance? So this questionnaire was answered by undergraduate that must have spent at least about 10 to 12 years in the educational system of Nigeria before getting to the undergraduate study. So from the survey I conducted, I noticed that the average of individuals get to hear about the word antimicrobial resistance after spending about 12 to 15 years in the university system, which is not encouraging, right? We know about malaria, we know about typhoid since in our elementary schools we read comics books on malaria, on typhoid, and the likes like that, which threatens the fight against malaria and again typhoid in our communities. But antimicrobial resistance is hidden and we don't get to hear them so well. Even undergraduates that are expected to be educated to a wide experts don't know about antimicrobial resistance till about spending the average of 12 to 15 years in the educational system, which underscores the less importance given to antimicrobial resistance and how it is a silent pandemic, that needs collaborative approach and needs youths to come in and raise awareness on antimicrobial resistance. And the fun fact is that antimicrobial resistance is a burden, greater burden than, which we'll be seeing here in the fourth slide. It's a greater burden than malaria and HIV put together. And we get to know about the burden of malaria and HIV, neglecting the impact of antimicrobial resistance on this diseases. Right. Next slide, please. So we have a mission at ODIAS. Our mission is to create a community of youths with the essential expertise to sustainably curb antimicrobial resistance and associated global health issues locally. So we are delving into building local ideas, local solutions to fight antimicrobial resistance, and seeing how we could collectively as youths curb the menace of antimicrobial resistance in our society. So that's the mission of ODUAS. Next slide, please. So this, as I'm sure you might know the species here. The species are, and the 5 individuals on the left hand side are the co-founding team of ODUAS, which were the individuals that went through the AMR ambassador program with South Africa, which you serve as my mentor or our mentor then. And these individuals went further after the program to see how we could leverage on the knowledge we've learned and provide sustainable local solutions to curb antimicrobial resistance in our environment. And we and led to the numbers you've seen earlier and the current executive board. Okay, can you all hear me? Can someone hear me?
Yes, I can.
Okay, thank you very much. So if you can't hear me, maybe you need to kind of change your network or you move to a better location, something like that. Okay. Thank you very much, Robin. So if you can see here, these are the co-founding teams of ODIAS, and now we have a larger working executives working in the background to make sure that we achieve the goals and visions of ODIAS, which is engaging youths to fight against antimicrobial resistance. Next slide, please. So this is statistics showing how antimicrobial resistance is okay. This is statistics showing how antimicrobial resistance is a burden in sub-Saharan Africa and globally. So this is showing that this is one of the most comprehensive um, reports we've garnered over time on antimicrobial resistance, showing how much or how many people have died due to antimicrobial resistance. And it's very, very devastating to learn that 1 in 5 of these deaths occurred among children under the age of 5. So this kills a lot of individuals, and yet actions are not being taken by youths to see how they could prevent the spread and occurrence of antimicrobial resistance, which strengthens why clubs like ODUAS needs to be supported, and individuals need to come and see how they could prevent the occurrence of this pandemic. Next slide, please. So this is a graph showing the burden of antimicrobial resistance in Nigeria, specifically having about 64,500 deaths attributed to AMR and 263,400 deaths associated with AMR. And in Nigeria, currently, the 20th highest age standardized mortality per 100,000 population, which underscores how AMR is a burden in Nigeria. Next slide, please. So this is a graph showing you the place of antimicrobial resistance in and the context of antimicrobial resistance associated with other diseases compared to other diseases in Nigeria. It shows that antimicrobial resistance is the leading cause here of deaths in Nigeria, surpassing enteric infection, cardiovascular diseases, HIV, other infections. I'm sure most of us know about most of the infections listed under antimicrobial resistance, but AMR still kind of sound abstract to most of us here, which underscores that antimicrobial resistance is not giving the needed attention to curb the menace, especially in Nigeria. Next slide, please. So we, as I've said earlier, we are having different teams of ODRs. We are a group of youths coming together to see how we could curb the menace of antimicrobial resistance. So we have team segmented into different facets. We have a team working on the editorial board, which is the editorial team. We have the communication team. We have the social media management team and the likes like that. So I will be calling on individuals to say a few things on what they are doing and a few things on what they intend to do moving forward, answering the question you sent to us on what we are doing about our communication teams and what we intend to do at a particular capacity. So I'll be calling on the editorial team, which is Umar. I think Umar is on this call to share with us what are we currently doing in the editorial team of UDIAS and what do you intend to do moving forward. Thank you very much.
Good evening, everyone. My name is Umar Farouk. I'm the editor-in-chief of UDIAS. To start with, I will be using the formats of the question that was sent to us. So to start with, the problem that we're trying to seek as a editorial board team, we seek to bridge the gap in awareness by producing informative content that improves the awareness and understanding of antimicrobial resistance among our target audience. So our target audience includes the university students, the high school students, and the local communities and the general public. We intend to reach our audience effectively. To reach our audience effectively, we utilize a multifaceted approach that includes article publishing, leveraging social media, and email newsletter to extend our reach. How we plan to do this? The project that we are seeking on moving forward, that we are planning to do moving forward, includes getting a publication repositories where we publish articles written basically by our team members. And also, we are trying to organize research writing training for our members to effectively master how to write research. That's that for me. Thank you, everyone.
Thank you very much, Umar. Thank you for ODS as mentioned earlier. We have with us here on this call to Habib. Habib is the outreach coordinator. He will be sharing with us what we do at the outreach segment of UDIAS and what we intend to be doing moving forward. Thank you very much. Habib, are you there? Can you hear me?
I'm sorry, I was having issues with my network earlier, so I've been trying to rectify. So hello everyone, I am Ivo Habibullah, and I'm the current outreach coordinator of UDIAS. So we now are at the point of outreaches. I feel the outreach is one of the most important parts of UDIAS as an organization or as a group, because it is the one chance we get to actually apply ourselves and have this hands-on approach and actually meet people and actually inform them about what antimicrobial resistance is, the effect of antimicrobial resistance, and the possible ways we can kind of try to stop antimicrobial resistance from escalating beyond what it has become. I believe from the metric we were shown earlier, we've come to see how it is it's the major cause of death in Nigeria currently. So I think from the time of establishment of UDIAS till date, we've been able to reach out to a number of schools and a number of university students. I think particularly in 2022, we reached out to two schools within Sokoto State, Nigeria. The first of which is the Caliphate School of Health, and the second is the Evergreen Schools. Moving on to 2023, we were able to see some improvements in our outreach, where we not only visit high schools, but we also had awareness programs for universities too. So I believe in 2023, we reached out to Success Academy and Brilliant Footstep Schools. They are both well-known schools in our locality. And then to commemorate the World AMR Awareness Week, we had 3 days awareness program, which was carried out in the university campus, and there was one that took place in the hospital, where we invited some of our professors, and they were able to link, antimicrobial resistance not just to people, but to the environment and to animals, where we were made to understand that, how the antibiotics that were given to, our cattle and our poultry could actually find a way to get into our systems. And if these antimicrobials, if they're being abused, how it could lead to formation of resistant strains in these animals. And if the animals are not well cooked, if they are not well processed, these microbes could actually get into the human system, and it could cause a major problem. It was a very, very wonderful, it was a very educated program, and I believe a lot of people learned a lot of things about antimicrobial resistance during those programs. And I feel 2023 was really a big year for us. We were really busy, and I think one of the importance of that year was seen in the number of participants we had. Like, we've had lots of volunteers. As Zachary said earlier, we have members from 25 different faculties in the university. It's the largest for the group so far, and that is wonderful, because it kind of gave us a direction into what we want to do next, which is increase our reach. Like, we intend to reach a larger audience, even beyond the confines of youth in our locality. And that's to say, we hope to reach out to young individuals in various other states around Nigeria. And not just that, we intend to reach out to the farmers through various departments. Like, initially, ODUYAS was more of health-related individuals, where we had individuals from medicine, community health, pharmacy, medical lab. But right now, we have people from agriculture, we have people from environmental studies. I feel if we go into collaborations with these people, I feel it should help us reach out to a wider audience. And currently, for 2024, although we've not planned out for the entire year, but I feel for the first quarter of the year, we have a campaign which we plan to take place in the last week of February, God's willing, and in March we intend to make an awareness campaign within the hospital. So, being coordinator, I especially look forward to these outreaches, and yes, I guess as a group we are doing the best we can. Thank you very much, everyone.
Thank you very much for presenting the updates, Umar and Habib. That's really amazing, all that you've been able to accomplish. And I think it's a testament to the way that you've organized, that there is power in numbers. So we are all individuals, and you are students, mostly are students, and so you only have a limited time. But in order to reach out to a wider audience, that having a large number of people contributing is so helpful. So I think it's really amazing, the work that you're doing. And yeah, I just wanted to acknowledge that. And it's been really satisfying for me to see how your groups have grown over time, from a centralized group at the Students Against Superbugs Africa to all of the regional groups, and that you can share information across the continent and globally. We have partners all around the world that are addressing this issue and trying to make it understandable for people. The points that you brought up about how it's so many people understand what HIV and malaria are, but that antimicrobial resistance is still not known by a lot of people, yet it affects many. And so I think the work you're doing is really important, and thanks for inviting me. I'm not sure if Zachariah is still on the call and if he wants me to transition to answering some questions that you provided. However you would like me to proceed, I'm happy to do so. But I did want to acknowledge that I think the work you're doing is really spectacular, and I'm happy to help advise in any way that I can.
Thank you very much. Thank you.
Okay, thank you very much.
I think we'll just proceed, because I think Zachariah is no longer on the call. So I think the vice president is around.
Great, thank you. I think that he perhaps had an internet issue, and I think he departed. So yeah, I do have some things that I wanted to share with you. First of all, I'll put some links in the chat so that you guys will have these as references. But I believe that Zachariah had already sent you the presentation that I gave in November of 2022. I put it in the chat. It's a Vimeo link. I am just wondering if I can share my screen. Let me see if I can do this. Let's see. Window. Okay, I'm gonna share my screen and see. Maybe that didn't work. Oh, yes. Okay, can you see my screen now?
Yes.
Wonderful. Okay, so this is the link that I provided in the chat. I believe you have already watched this presentation, but it has, I wanted to point out a couple of things. It does have here, if you are finding hard to understand me, you can put on the English captions. So this is captioned all the way through. It also has links here. So if there's a part of the presentation that you want to go back to that you found helpful, the information, it has time code down here, and you can see all the different sections, and you can go back to that. And then I did also provide a link to my slides. And so in that presentation, I'm going to share. Let's see. Yeah, so in this presentation, there are these slides, and I wanted you to have a PDF of them because I do have links to references that you might find helpful. And so you can click directly on the link and it will take you to different references throughout the presentation. But yeah, it'll give you the basics on some tips on how to reframe antimicrobial resistance. So as you're communicating with your communities, some really basic tips on how to simplify the language. And it will also give you, let's see, some ideas about, you're already talking about these different things, which is wonderful. So how are the different ways that you can communicate through articles, radio, podcasts, video, TV, classrooms? And a lot of this you're already doing, which is amazing. So it will give you some examples here and ways to reach out, how to pitch, how to actually think about topics and drill them down into story ideas if you want to write articles. And so there are a couple of examples there about how to take a broad topic and drill it down to a narrow story angle. And then ideas about reaching out through your networks. So if you want to reach out to your university and high schools and local communities, finding ways, really thinking about your audience and how they get their information. It has, suggestions on news, radio, TV stations that are local. And then just additional suggestions on how to reach out through different organizations and news outlets beyond the local. So BBC has BBC Africa. And also some advice here is a nice YouTube video you guys could watch where editors are talking about how to pitch. So that might give you some helpful information about how you would want to then reach out with your story ideas. Yeah, so I just wanted to let you know these resources are here to look at. There's a lot of information that should be helpful. And for the next thing, I did want to mention that there were a couple of questions that Zachariah had posed, and he said that one thing that you all might be interested in would be some internship opportunities. And so there are a few things that I think you could think about, and that would be different offices in the government that you could reach out to, health offices. So one example would be the Nigeria Center for Disease Control and Prevention. And let me put this link also in the chat so you can check that out. I would read up to see if the fit is good for you, but I noticed that this application was due in October. But I would say this is a good example of like reaching out to your government public health offices and seeing what kinds of communications they have in place and if you can help them in any way. So there might be a formal internship program, but maybe there's a way also to reach out to folks who are working for these organizations. A lot of times people in the government have very little time, and so they would absolutely welcome any sort of support from the community. So you have projects that are in progress that maybe you could partner with the Nigeria CDC. So I would recommend reaching out to them. And even though this deadline has passed for this internship, perhaps there's a way that you could recommend or propose a project to support the work that they're doing and getting the word out about antimicrobial resistance. Another internship opportunity is with the One Health Trust. And so this organization, I spoke about it in the presentation, in the video presentation, but they're looking at the things that you're concerned about as a One Health solution for antimicrobial resistance. So, it's not just about the antibiotics that we're giving to people, but also to animals and livestock. And so they also have a reach in places all around the world. And so antimicrobial resistance is one of their main research areas. And so they do have an internship program. You can apply on the website. And if you are interested and you do apply on the website, one benefit I would say of One Health Trust is that they have a lot of materials and they're working on this specific issue. So, it would be a nice opportunity to learn from another organization, also to teach them what you've learned. So that kind of collaboration could be helpful. And the person who is in charge of communications, her name is Sam Serrano. I'm going to put her LinkedIn in the chat. She said that if you do apply for an internship with One Health Trust, that you should do it on the website, and then you can also email her. So I put her email in the chat. So just follow up with Sam to let her know that you applied. But yeah, it's, and she said that they're, right now, I wrote to Sam about this. She said that they're accepting applications on a rolling basis for communications roles, to also email her. First apply on the website and then email her. She said they don't have funding right now for interns, but if someone wants to join for limited hours per week for experience and to create a writing sample, she would have space for 1 to 2 interns in April and May. So one of the other benefits actually of doing an internship or working with your government, working with your universities, even if they're unpaid, it's an opportunity to build your portfolio and to get some writing clips. So Sam is really great. She has worked with students from the AMR Ambassadors program to help them write blog posts. And so it's a really good way just to get experience to write for the public and have a professional edit your work. So I think that could be a potential opportunity. The other one that I wanted to mention as well is that there is an organization called the Trinity Challenge. And so this was started in, it was launched in 2020 in response to the COVID pandemic. And so the whole idea with the Trinity Challenge is that they're looking for data-driven solutions to help protect against global health threats. But in November of 2023, they actually switched to antimicrobial resistance. So let's see if they think that they have a challenge here for AMR. So they're really focusing on antimicrobial resistance now and looking at data and analytics to reduce the impact of antimicrobial resistance and bacterial infections all around the world, in particular in low and middle income countries. So the thing that I wanted you to know about is that we had a call with the Trinity Challenge because they're also developing communications. And so one of the members, the founder of Students Against Superbugs Africa, his name is Daniel Werungi. Daniel and I and a few other people met with the Trinity Challenge last month to give them some feedback about communicating about antimicrobial resistance. And so this group is looking at trying to develop more effective ways to educate people about this complex health issue. So when their study is completed, we can share that information with you. But in the meantime, I did reach out to them to ask them about any internships. And I was told that right now there are no internships, but there is going to be potentially, sorry about this. Let me put this link in the chat for you. There will be an AMR Youth Summit, potentially. They're looking at raising funding for that. So that's coming up that, it might be something you might want to look into participating in. And the Trinity Challenge is also going to seek student volunteers on its review group because it is going to be reviewing proposals for this challenge. And they said that they will be like students to be a part of the group where you can review some of these applications. They're going to be forming a semifinalist shortlist in March and then submitting them to the judging panel. So that would be a pretty cool way to get to work with some people globally. The folks that are spearheading this are in the United Kingdom. If you go here, there's about the board. This person here, Dame Sally Davies, it was the chief medical officer for England and the senior medical advisor for the UK government. And she actually made antimicrobial resistance the key issue for the United Kingdom when she became the chief medical officer. So it would be really, if you wanted to get involved, you'd meet some people globally that are involved pretty with a strong emphasis on this issue. So the person that I spoke to, his name is Hamish Morrow. And so he works with the Trinity Challenge. And he said, if you are interested in the Youth AMR Summit and the review group, that you can contact him. So I'm going to give you his email address. So if you want to reach out to Hamish, he said that you can email him for more information about that. And let's see. Okay, what I also wanted to let you know is that you guys asked me how journalists and content creators can collaborate with healthcare experts to accurately report AMR related issues. And I think what is really great is to be able to have some ideas, and you could pitch articles and opinion pieces, or even offer to be interviewed on local radio or TV. But I wanted to mention someone who is an expert in the field and in science and health communications. His name is Charles Wendo, and I attended a conference in October called Science Writers, and he presented. And he is a journalist, and he works for scidev.net, which is based in Kenya, although he did his training at Makerere University. So he's a science journalist, a media trainer, and a veterinary doctor. And he has worked as a training coordinator for scidev.net since 2017. So what he said is he noticed a lack of capacity for science reporting in Africa. He got many calls from journalists on things like how to find sources, how to get story ideas. And so because he kept getting these calls, he thought, I really should build resources for journalists on how to report science stories, but also for scientists and people who are interested in medicine and health to communicate their research and these important issues to the media, policymakers, and the public. So I'll put these links in the chat for you, but it's free. These are all online courses in science communication that are free, that he's developed, that I think could be really helpful for you guys to check out. So I'm going to put these I'm going to put this information. So that's Charles's LinkedIn. And then these are some other SciDev resources I'm going to put in the chat for you so you can check them out. Okay. So yeah, so courses on science communication for journalists, how people who are scientists and health professionals can communicate their research for non-scientists, and also how the science communication skills for press officers. And then these guides I thought were also really helpful. Here's things that you may want to know, like if there are controversial issues, using social media. He has a whole guide on that to communicate research, where you can find your stories, how to start a blog, how to brief policymakers on science issues. Maybe some of you are interested in giving talks, public speaking. He has a guide on that, and reporting scientific findings and more. So I think these could be really helpful resources. He also has supported 4 African universities to embed science journalism in their curricula. And he's also published a book, Science Communication Skills for Journalists, which I'll put that also in the chat, the link to his book. And a couple of the other questions that I wanted to answer for you. So you asked me what strategies have been most effective in raising public awareness about AMR. I think that there are a few things, and you're already doing these things. It sounds like, which is great. Teamwork. I think that's the key, is growing the network of people who understand the basics about the science and ways to help reduce antibiotic resistance. So I think you're on the right path about sharing ideas and building your network. And polling, you're already doing this. Zachariah spoke about a survey for undergraduate students, and I think you can do this even more, is ask people in your communities about these issues and try to figure out what they don't understand, and then tailor the messages to them. And then meeting the people where they are, I think, is key. Like going to, and you're doing this. So this is great. Like you're doing the right thing, is going to schools, hospital waiting rooms, bus stops, like essentially where you can have conversations with people who are already there. I would say that the key would be to get permission. So if, as you are forming these relationships with schools and hospitals in particular, contacting the right people who have, can give you permission to access those areas to talk to people. So the principals at schools, for instance, the administration and the administrators at hospitals would be great people to talk to make those connections. And then I would just say, start slowly. You guys have a lot of things that are on your plate outside of this group. So, make sure that you're taking care of yourselves and your classwork in addition to this. So, and don't discount the individuals that you're helping. So, if you teach one person about these issues, then it can spread, right? So I know you want to reach a large group of people, and so it's good to think about those strategies for reaching wide audiences. But if the individuals that you reach are people who can then spread the word, so be proud of what you do on an individual basis as well. Okay, a couple other things that you asked me about. You asked me what innovative approaches can be used to engage people in AMR advocacy. And I think that I have had conversations with students in your groups, and the things that they mentioned before were, one thing that inspired them were the HIV campaigns. And so, the outreach and the simple messaging. So I think that looking to other campaigns, like the HIV campaigns and getting inspiration there would be helpful. I also think that there are other groups that are doing work that you're doing, and this is one example, which I had mentioned in the video. But this group is based in India, and they call themselves Superheroes Against Superbugs, and I would absolutely recommend checking out their website, because they've made videos, but they also have comics that they've developed, and they reach out to schools. So you could take a look at their website and just see, read through the kinds of work that they're doing, and it might give you some inspiration about how you would want to approach reaching out to schools and developing activities for children. And then I would say the other thing that you might want to check out too is the Welcome website. So they have a whole report that they created on reframing how we talk about antimicrobial resistance, and they have a video and simple. The report is long, but they have these 5 messages on how to talk about antimicrobial resistance. So I would recommend checking out the Welcome website, and just for some basic tips. The other thing that I would recommend would be you had mentioned wanting to have people to collaborate with on writing. And then this group, SIDRAP, had actually worked with the Students Against Superbugs Africa, and they had some writing workshops. So the team would be great to reach out to if you want to reboot that and get some experience and see what kind of collaborations you all could maybe have. But they do have, their focus is infectious diseases, and so one of the themes is antibiotic resistance, and they have communications, outreach, and engagement activities. So they have actually developed a communications toolkit. And that's something you guys might want to check out for inspiration, even reusing. Like, a lot of organizations will develop these materials and you can reuse them. And I think the key is like linking back to their organization, giving their organization credit. But I think that, that it is available for the public to share, then it's nice to be able to have those resources ready. They also host a series of tweet chats. So they get people involved in talking about antimicrobial resistance on Twitter. and they have different themes. So you could also see if you wanted to participate in those or host your own tweet chats. They also have a podcast and a stewardship spotlight podcast. So they are bringing together stories about drug-resistant infections from patients, doctors, researchers, and also interviews with global experts on antimicrobial resistance, including diagnostics, health literacy, science communication, and more. So I think these would be great resources as well. You had mentioned wanting to develop a newsletter, so I would check out what CIDRAP is doing for their newsletter. That might give you some inspiration, but maybe there would be some opportunities for collaboration. And then this is the program that they worked with the Students Against Superbugs Africa. And so it was a writers and content creators program, and led by Francesca Chiara and Chris Dahl and Natalie Veston. So I would check out some of the blog posts if you haven't read them already. And if you want to contribute more, CIDRAP might be a good organization to contact to team up with them. And it looks like they also have a fact sheet, but a lot of information. So there's a lot of information that's already been developed that I think could be helpful to reuse. I think if you are going to do that, it's always important to give credit to the original authors. So I think those were the main questions. And then I think the last question that you asked me was the role of storytelling and the conveying the impact of antimicrobial resistance. And I think that's really important. I think if you are able to talk to people who have been personally affected by resistant infections and telling those stories, then it makes this concept real to people. People will listen if they know that other people have had an impact, if there have been people who have died, or if there have been other health complications. And then I think also telling the success stories is important too. So if you notice things in your community where maybe there is a movement to improve infrastructure, access to clean water, hygiene projects, and things like that are positive and that you want to celebrate. I think that also tells an important story. And also thinking about collaborating with the government or your community workers to build infrastructure that also relates to antibiotic resistant infections, how disease spreads, having good hygiene, clean water, things like that are really important. And infections can spread when those are not in place. So having some kind of collaboration to support those type of community projects, I think would also be really important. So I think that is all the information that I had prepared based on your questions. I wanted to thank you for inviting me to speak with you. And if you have any follow-up questions for me, I'd be happy to answer them. But I really wanted to thank you for inviting me to be a part of your event today and to be a part of your the movement that you guys are creating.
Wow, thank you very, very much, Robin. I must say that I really enjoyed this presentations and the resources that you shared with us today. And I'm very, very sure that there's the same for almost everyone on this call today. And we are very, very grateful for your time and the thoughts you put to putting all these resources together for us all. So we will be moving forward to see how we collate all these resources together and make them available for our group in a particular document, so that everyone will have access to them and benefit widely. Thank you very, very much for your time. Yeah, Faith will be making collation of all these links together and sharing them together with you and everyone else too. So at this point, you'll be having questions and answer. I think for me, myself, I have a question for Obin. And if you have any other person that have additional questions for her, please use the raise up hand button. Then we call you on to ask your question. Thank you very much.
I see there is a hand raised. Please feel free to ask your question. Absolutely. I'm happy to answer any questions.
Okay. Let's have you, Idris.
Okay, good evening, everyone. Thank you, Robin, for that wonderful presentation. We really learned a lot, and we are very grateful for your time. My own question is specifically based on the issue of AMR. We have been directing it from Udia's perspective, looking into young stewards in university and also students from secondary school in order to give them orientation on the preventive measure of these menace. But as has been said, that UDS is comprises of students from medical and non-medical faculty. But the issue that I'm having is that yes, we are directing our communication and also our the programs that we have been offering to students and also to those one that that are in secondary school. But and some of us now that maybe we are already moving out of who we are, like we are graduating students now and moving forward into professional field. When you are communicating with professional, those that are even medical oriented on their own on this issue of AMR and letting them know their own contributing factor that they are bringing in, they seems to be using their own reason just to be going against you. One of the major causes of this issue has been self-prescription of drugs. But if we check mostly, even if we look around, most people that do self-prescription are medical personnel because they just do like they have the knowledge and they have the idea. Then they prescribe drugs for themselves, they take it. Even when they are, it's not only about maybe prescription of drugs, their activities, the way they handle things, they see these things as maybe they are not of really concerned or even when you are trying to just have a professional discussion with them on how to correct all these issues and the way to move forward, it will just be there is a way. So my question is majorly that how do we think that we can communicate even this issue better, have a proper professional discussion within those even that are of medical oriented on this issue of AMR. Thank you.
Oh, that's a really good question. And so what I will say is that this is not just a problem in Nigeria. This is a problem everywhere. And I think that so when patients, what I've learned is that when patients are sick and they go to see a doctor, that sometimes what will happen is the doctors will prescribe them an antibiotic, even if they don't know it's a bacterial infection. So, and one of the reasons is because the typical diagnostics can take days for the results to come back. And so one practice has been that doctors will prescribe it in the hope that it can treat the infection, but they might not even know that it's a bacterial infection. So it is kind of this common practice. And the thing that would be really important is that people around the world are working on rapid diagnostics. And so that's key, right? And diagnostics, there is an issue there too because of cost, right? So we need, yes, someone wrote empirical treatment. That is correct. I was trying to simplify the way I'm describing the problem, but yes, the word empirical is correct. When doctors give antibiotics without knowing if the cause is in fact a bacterial infection. So yeah, so the key is to try to get quick diagnostics that are that are cheap, right? So people can afford to use them, and that within hours. So the patient goes to see the doctor, and just within that appointment, they can have a diagnosis, and then the results come back. And then if that result says, yes, you have a bacterial infection, and they've tested it against a certain panel of antibiotics, and they all know which ones could potentially be effective, that is the ideal situation. But I think that we're like a long way away from that being accessible around the world, even in the United States, even in places where there are a pretty good amount of resources. That's one thing that I worked for an organization called Carbex, and that's what they do, is that they are supporting product developers to try to get to that point. Yeah, I think that some things that maybe could be done would be to contact organizations that might have some sort of connections with the governments and with the public health systems, to see what they're doing to educate rather than reinventing the wheel. I would try to dig around to see what kind of education exists. So I think actually I do recall reading the blog posts on the CIDRAP website, and I do believe there was an assessment by one of the writers from the Students Against Superbugs Africa to look into the medical school education. So there would be pharmacy students who are going through, like, what kind of education are they receiving? And then are they receiving education that's going to be helpful to their patients? And are they putting that into practice? So I think it is one of those things where if you're going to be talking to, medical providers or getting involved in that, it is something that would be important to do with the collaboration of other medical professionals and public health providers, to look at the infrastructure to see how people are being educated. And if there's a way to support that kind of education to help. But I think that, I think that some people mean well, and I don't know what the practices are in different places. And I think what would be really important to do is to tap into experts in public health and in the government to see what is the proper way to prescribe, and what kinds of information are they offering to providers, and should that be changed? But I think it would be important to work within the system, like to support what's already in place, and to help move that forward. I don't know if that's helpful.
Yeah, I think that's very, very well thought, and it kind of explains how and answers the question of issues. And I think we need to have more investments in education, so we have faster turnouts of antibiotic sensitivity testing and all, so that we could curb antibiotic resistance. Thank you very, very much for answering that, Robin. Do you have any other questions from participants on this call? So I think I have a question for Obin. I have this thought that when we were kids, we actually used to read comics on malaria, typhoid, HIV, and the likes like that, where we get to understand what antibiotic resistance is. Malaria and the likes of them is when we are very, very small, right? But we don't get to see comics on antibiotic resistance. So most of us actually are hearing antibiotic resistance in recent years, maybe from 2019 to this year. Previous years we have received we have not never heard about antibiotic resistance, if that's correct. Right. So I was thinking that maybe it might be due to the ambiguity attributed to antimicrobial resistance. You get to hear people saying antimicrobial resistance, you hear people saying antibiotic resistance, some people call it multi-drug resistance and the likes like that. So it takes you to understand the whole the whole concepts, to know that all these things mean the same thing. So can we have a particular word? I've heard somewhere, maybe if you have a particular word to kind of explain what antibiotic resistance is, like the way we know for cancer, you know that we have different type of cancer, but it's all called cancer. And if you say cancer to someone, he or she understands that this is cancer, and cancer is this kind of malignancy or something, right? Can you have a single word that could define what antimicrobial resistance is, instead of having segments of antibiotic resistance and the likes like that? And can that solve the ambiguity that's attached to AMR? Thank you very, very much.
Yeah, that is such a good question. And that is something that the people have been talking about. They call it alphabet soup. This problem that because like you said, antimicrobial resistance or antibiotic resistance, is about different kinds of bacteria. It's not just one species of bacteria. There's so many of them, and it's about this process of evolution and how they change to evade drugs. So it's a big concept. And there are experts. We had a conversation. That was the Trinity Challenge. And I'll bring that back up because I think that might be something you guys might want to get involved in. But yeah, this group, the Trinity Challenge, they have communications experts who have been interviewing people about this. And even Wellcome, this large organization, has some advice on how to talk about antimicrobial resistance so people will understand. But I think that people are still trying to figure that out. And so once this study has been conducted and comes out, that's something that we could share. And but I think it might also be helpful to talk to people in your communities about what words they use to try to break through and educate people, because I think it's also important to note that we all come from different places and there's so many different languages that are used. And so certain words that are used in English, maybe the concept doesn't translate in other local languages. So I'm sorry I don't have a particular answer for you, but I do know that people are working on it, and this issue that you've identified of communicating a challenging problem. They're trying to come up, I know the Trinity Challenge, they're trying to come up with metaphors like that can be used that people understand to convey this problem. So I can keep you posted. And when I think that they're doing this survey and they're working with a communications group, and when that comes out, I can share it with you. Maybe that will be helpful. But I think listening to people in your community and asking them what they understand and trying to communicate in a way that works for your community is going to be important. And I think that might be different from place to place. Yeah, so I wish I had I wish I had an answer for you, Zachariah. One thing I think that they talked about is, do people understand generally what antibiotics are, and should we call it the antibiotic crisis instead of antimicrobial resistance? I don't know. So I think people are still trying to figure that out.
Okay, thank you very, very much, Robin. I think you gave a comprehensive understanding to the question, and I'll be glad to have received further resources from you on the particular question, which I'm very, very glad to read on and learn on that too. So thank you very much once again for your time. I think we do have any questions from any other person on this call. So I think we have no questions for you on this call again. And as I've always been thankful for your time and for your support over time, your mentorship, and for the guidance you have been availing for myself and for my team members. We are very, very grateful for your time, and we look forward to inviting you in further discussions and sharing with us your expertise on antimicrobial resistance and communication in the space of science. Thank you very, very much for your time once again.
Thank you very much. It's a pleasure. I really wanted to say how impressed I am with the way that you're gathering and that you are working together on this issue. And And I'm grateful for that. I think there are a lot of people around the world who find this to be really important, and it is great to see the work that you're doing. And I think we can all learn from one another. I did see in the chat that Faith, yes, Faith asked about getting all the links in one place. I can put together a Google Doc with all the links, and I can share it with Zachariah. And you know, if Zachariah can forward that to everyone, that would be great. And if there's anything, I also updated my email in that link on the slides, because I no longer work for Carbex, but you are welcome to email me. What I will say is that, why don't I go to my, so if you guys want to connect with me on LinkedIn and send me a message through LinkedIn, just let me know you were on this call, so I know who you are, because sometimes I'll get random requests to connect, and if it's a stranger, I probably will ignore it. So just let me know that you're a part of this group. But if you want to connect on LinkedIn, please feel free. And then if you have any follow-up questions, you know, you can reach me through Zachariah, but you can also contact me by email. Just let me know who you are, and that, you know, you are part of this conversation, and give me some context in that. That would be great. But if you have projects that, you know, you want some feedback on, or, you know, you want to continue the conversation, I am happy to do that. And again, I just wanted to say how much I appreciate what you're doing, and if there's anything I can do to offer advice, you know, please do not hesitate to reach out. And I wish all of you the best.
Thank you very, very much, Robin. I think me and my team have been in discussion to reach out to you on a particular project we are working on. It's titled AMR Rise, and I think I'll be sharing with you the whole synopsis of the project moving forward. I'm very, very grateful for your time, and I'm sure that most of us on this call are also grateful for your time. And I saw a comment on the chat box saying that individuals that are not under Usman Open University or are not members of ODIAS, this call or this webinar is for youths and youths across all facets and across all countries. So you are welcome to be part of UDIAS, and you're welcome to join subsequent meetings too. And you're welcome to fight against antimicrobial resistance and associated public health issues in your community. So thank you very much, everyone, for joining. And I'm sure we have had a great evening with us all here today. I would like us to reach out to Robin. If you have more further questions, you can reach out to me too, and I will be glad to write an introductory message or send you an email if you feel that's okay by you. Thank you very much, everyone, once again. I think we will be ending the call at this moment. Thank you very much for your time. Bye, Robin. Thank you.
Thank you. Bye. It was really nice to meet everyone. Have a good weekend.